Josh Bruce and Sean Brock here again, going over different exercises that we use to help assist with the treatment of plantar fascial pain. All right. First exercise we're going to go over today is strengthening for the deep toe flexors, flexor digitorum, and flexor hallucis through here. So we're going to take our garden variety exercise band here. All right. Patient in a seated position. We're going to again separate the smaller toes from the big toe here. So we're going to put the band around all the toes, grab the end, and then we're going to instruct the patient to flex their toes, hopefully at the metatarsal phalangeal joint here. All right. I typically say it's okay if we lose a little toe. More than that, I want them to reset. You should feel the effort and the pressure through the bottom of the foot, maybe a little bit deep in the calf. Some patients will feel a lot of pain or stress right along that metatarsal phalangeal joint. If that's the case, lessen the tension, or sometimes I will help give them a little bit of support here so they can feel where they're supposed to move as they're going through the exercise. All right. That's another good thing to go over. A lot of patients will put the band down below on their toes, and that will limit the effect we want working through the toes, so make sure the band covers, and go ahead. Feeling that right in the bottom of the foot here?
Yes. All
right, perfect. So a great exercise for Sean today, and that should, as he builds up strength through his foot, through his toes, that should help to support and take some of the stress off of the plantar fascia. All right, and then just a slight subtle adjustment for this next exercise. It's the same exercise, but now we're focusing on the flexor hallucis. So we're going to put the band around the big toe and repeat the same exercises. Typically, the patients will feel this a little more immediately, but still should be on the bottom of the foot, curling the toes. All right, so this next exercise here is a perfect example of the test becoming the exercise. So if someone struggles with the lunge, I can very easily make that exercise for them. So Sean, let's go ahead and have you in that split squat position. All right, and I want you to pay attention to keeping your knee out. All right, engage those external rotators of the hip on the way down and the way up. Good. Again, if this is easy, we can now progress the exercise by decreasing stability, either progressing to Bulgarian split squat or even a single leg lunge or single leg step down. All right, the next exercise we have here is some eccentric calf raises. So Sean's going to come up and then slowly lower down, his heels down below his toes as far as he can. Should feel a little stretch and a load through the Achilles tendon as he comes back up. All right, and again, we're paying attention to the eccentric or elongating portion. You'll notice that Sean made a quick progression here, transferring from 2 legs, which is easier, to putting the whole load on 1 leg. We can also add weights as needed to increase the load. All right, so now we've gone through, we've done our assessment, we've done our soft tissue treatment, including our use of the SMART tools. Follow that up with exercise to reinforce and support the plantar fascia. Now, the final part of my typical treatment protocol here is to use some kinesiology tape to help reinforce the patterns that we just created with our exercises. So I'm going to take 2 strips here, one short to kind of help support the plantar fascia directly, and then we're going to do a longer strip here to kind of support that motion of external rotation and assist with restricting pronation or slowing down pronation to take tension off the plantar fascia. So as always with our taping, no stretch on the ends of the tape. And apply this kind of in the middle of the arch here. All right. And then we'll put some light tension up through this direction. Supporting through the arch, coming up and around. Yeah, and I'll have you kind of internally rotate your leg through here, Sean. So we can lay that down. Take out all the wrinkles here. And then to work through the plantar fascia again, I'm actually going to put a little bit of tension on this tape here, so we'll have you kind of curl just a little. No stretch on the end of the tape here. Draw some light tension through the plantar aponeurosis. Go ahead and extend your toes for me here. Good. Lay that down. Now we have a nice bit of support to take some stress off the plantar fascia. as well as some proprioceptive or kinesthetic awareness to help increase that external rotation, supination through the foot. Thanks for stopping by, checking out our brief treatment of plantar fasciitis. Hope you come back for more videos we have coming in the future. Thanks.